So what is Botox? Well, Botox is a neuromodulator that can be injected for cosmetic purposes to reduce and minimize unwanted facial wrinkles. The way Botox works is it simply temporarily prevents the communication between nerves and muscles. And when the nerves can't tell the muscles what to do, the muscles relax and wrinkles disappear. Botox is primarily used in 3 areas of the face: the glabella region, which are the frown lines in between the brow, the forehead region, which is the horizontal lines across the forehead, and the muscle group called orbicularis oculi, which are around the eyes, and that causes crow's feet. There's a complete misconception that Botox neuromodulators are only for old people. It's simply not the case. It's dependent on the specific patient. I've seen women in their 40s who have very, very few wrinkles because they've done a great job with their sun protection over time. Typically, people start in their mid-30s, 40s, and 50s. However, I have personally injected patients as young as 18 years of age because they have deep creases, deep lines, deep furrows in their forehead because of stress or just premature aging in their life. If you start early, you can put off the signs of these wrinkles, you can prevent them from forming, and it's a whole lot easier to keep things from forming than to correct things after they've already been present for a while. So start early if you want to avoid premature aging. Botox is exceedingly safe. It's one of the most studied medications in the world. It's been around in the market for more than 20 years, and good or bad, it only lasts 2.5 to 3.5 months. So how do we know it's safe? Well, it's out of your system sometime around 3 months. I wish it lasted longer, but right now the current formulations only last that specific amount of time. People are needle phobic, but that's because as a child you had to get vaccines. Those are big needles that go deep into your arm or your buttocks. Botox is very different. It's a very small needle, very tiny, and it just goes below the surface of the skin. Most people say it's exceedingly tolerable. Some people don't mind it at all. The clinical physiology of Botox is fascinating to me, so let me explain it. It takes a couple days for Botox to work. Day 14 is when it will be its strongest, and I think it looks most natural 6 weeks after you do it. So I think it's very important that patients understand and have that level of communication wide open with their clinician who's treating them as to when they're getting treated. If you have an important event in exactly 2 weeks, maybe reschedule your Botox. If you have an important event in exactly 6 weeks, that's the time to get it. LaserAway is the leading aesthetic dermatology provider in the United States. And when you come to LaserAway, you're getting customized care. What that means is if you're new to the neuromodulator market, you've never had Botox, well, we can use baby Botox, just a very few little units, explain the process, and be extremely conservative. Or if you already have experience with Botox and you want to dive right back in, well, we'll find a customized routine care for you that fits your specific needs.
Like that video? Make sure to subscribe to our channel by clicking left. And for more awesome videos, click right. And to schedule your free consultation for any of our services, click the on-screen link. What are you waiting for?